Hello, my name is Jeremy. I am a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and let's go ahead and get started. Okay, so you failed your first nursing exam. Okay, first thing I want to say is it sucks, but it's not the end of the world. Okay, so, and I want to start off by basically saying when I did, right now I'm in community health nursing. Well, I just finished community health nursing, but like when my first nursing exam, I actually failed it myself. I think I needed like a 78, ended up getting like a 75 or something like that. But it's not the end of the world. You got more tests coming up. As long as your critical is above where it needs to basically be, you should be fine. But here's some tips that's going to help you out. First thing you want to do, you want to basically get on a group chat with your classmates. You want to get familiar with them because like normally if before this time span you're probably doing it on your own. Nursing school is going to make your life a lot easier if you basically create a group chat and you get involved with the other people. And for the most part, in my honest opinion, there's probably going to be always at least one or two people that's smarter than you, or even the smartest person in the room can be looking at it from one angle that you'll probably see it from. So it's never going to hurt to help somebody out. So that's my first tip. Second tip, talk to your professor. See what you can basically do. Schedule one-on-ones. One-on-ones is the biggest thing that will go from there. The professor may guide you in the right direction to find out what type of style of learner you are, then recommend the best resources for you. Then there's that. Then the next one is scheduling. How many hours are you putting in? How often are you reading and stuff? So with that, when it comes to that, I get people say you got to put more time in, but it doesn't mean anything if you're not doing it correctly. I say this because I used to read strictly out of the book, read, think I'm going to get anything, but I'm doing more of a passive learning, kind of like walking in lecture, but like I'm reading it instead. There's a difference between passive learning and active learning. Passive learning is lecture and reading, which works for some people, but sometimes you can read stuff and then you can just forget it. But if you do it in a manner of asking questions during a lecture, writing down notes during the lecture, or recording the lecture and then writing it down, and then having it before a test date and stuff, like having questions for the professor so you can have a general idea of these concepts, it'll increase your chances of getting that material correctly. So that's another way that you can go about it. Different learning styles that I can think of off the top of my head is audio, visual, and kinetic hands-on. If you already did the database to find out which one you basically are, which you usually do it on the T's or the pre-nursing course, go by that aspect. It should help you out tremendously to basically increase your score. So the next thing you have to basically focus on is taking it 1 week at a time. If you think that like your first exam, after failing your first exam, that you're gonna fail the course, like calm down, one step at a time. I get it. You've invested a good amount of time spent to get there in the first place, but it is a different beast. You're taught beforehand, like A plus B equals C type of thing, or 1 plus 1 equals 2, or 2 plus 2 equals 4. In nursing school, you got to be a little bit more critical thinking. So it's kind of like restructuring your way of thinking. So it takes a little bit to adjust to it, but it'll come. And that's the reason why I say that working with other people helps out tremendously and makes your life a lot easier. And also and studying the right way, studying smarter instead of harder, is going to make your life a lot better. And that's pretty much it. I know you got this. One more resource, actually, bonus resource. Tutor.com actually focuses on giving you tips on what you should basically do and your professor may refer to it as well. If you need like a research paper, you could submit it to them online, and within 12 hours they give you back feedback. Most of my classmates say they get it back within like an hour or two after they submit it, and they basically let go from there. So that's a quick tip right there. So you got this. Keep pushing on. Take it a week at a time. If you can't take it a week at a time, take it a day at a time. If you can't take it a day at a time, take it an hour at a time, and just go from there. Simple steps, and you got this. Like, comment, and subscribe, and more content on the way.